Good morning, everyone, and welcome. Today, we're going to explore a comprehensive overview of drug abuse. We'll be diving into the causes, the signs to watch for, methods of diagnosis, as well as treatment options and prevention strategies. This is a critical topic that affects so many lives, and I'm excited to share this information with you to deepen our understanding and promote healthier communities. Let's get started. When we talk about drug abuse, we're referring to the harmful or hazardous use of substances that affect the mind, such as illegal drugs, prescription medications, and alcohol. This kind of use can lead to serious physical, psychological, and social problems for the individual involved. The impact on a person's health and daily functioning can be profound, often disrupting their ability to work, maintain relationships, and manage everyday responsibilities. But drug abuse doesn't just affect individuals. It also has broader consequences for society. It can drive up healthcare costs, contribute to crime rates, and result in lost productivity, all of which have ripple effects in our communities. Among the drugs most commonly abused are stimulants like cocaine and methamphetamine, which speed up the nervous system, and depressants like alcohol and benzodiazepines, which slow it down. In addition to these, other frequently abused substances include opioids such as heroin and prescription painkillers, cannabis, and hallucinogens. Understanding these categories helps us grasp the wide range of substances involved in drug abuse and the different challenges they present. When we look at the causes of drug abuse, several key factors come into play. First, genetic predisposition plays a significant role. Some people have certain genes that make them more vulnerable to becoming dependent on substances. Then, environmental factors are crucial. Growing up in a family or community where drug use is common can increase the risk. Psychological factors also contribute, especially if someone struggles with mental health issues like depression or anxiety, which may lead them to self-medicate with drugs. Social influences are another big piece of the puzzle. Peer pressure and the cultural normalization of drug use can push individuals toward trying and continuing drug use. Starting drug use early in life is particularly dangerous because it raises the odds of developing addiction later on. Lastly, many people turn to drugs as a way to cope with stress or emotional pain, which can create a harmful cycle. Understanding these causes helps in addressing and preventing drug abuse more effectively. When it comes to identifying drug abuse, there are several signs and symptoms to watch for. First, behavioral changes are a big red flag. This might include noticeable mood swings, increased secrecy, or someone withdrawing from their usual social activities. Physically, you might see signs like bloodshot eyes, unusual weight loss or gain, or a decline in personal hygiene. Health symptoms are also important. Frequent unexplained illnesses, like infections or respiratory problems, can be a clue. Psychologically, drug abuse can manifest as heightened anxiety, paranoia, confusion, or agitation. You might also notice performance issues, such as a decline in work or school performance and increased absenteeism. Finally, financial problems are common, including an unexplained need for money or sudden financial difficulties. Recognizing these signs early can make a big difference in getting someone the help they need. When diagnosing drug abuse, there are several key steps we follow. First, a clinical interview is essential. This involves taking a detailed history of the person's substance use and any related behaviors, which helps us understand the scope and context of the problem. Next, a physical examination is conducted to check for signs of intoxication, withdrawal symptoms, or other health complications that might be linked to substance use. Laboratory tests also play a crucial role. These can include urine, blood, or hair analyses to confirm the presence of substances in the body. Alongside the physical assessments, psychological evaluation is important to identify any coexisting mental health conditions that could be contributing to or affected by drug abuse. Finally, screening tools like the CAGE questionnaire for alcohol, the audit for alcohol use disorders, and the DSD for drugs are used. These instruments help quantify the severity of the abuse and assess the risk, guiding us toward the most appropriate treatment approach. Each of these components together forms a comprehensive picture necessary for accurate diagnosis and effective intervention. When it comes to treating drug abuse, there are several key approaches that work together to support recovery. First, detoxification is crucial. It involves medically managing withdrawal symptoms to keep the person safe while they stop using the drug. Next, Behavioral therapies like cognitive behavioral therapy and contingency management help individuals change harmful patterns and build healthier habits. Medication-assisted treatment is also important. Drugs like methadone and buprenorphine can reduce cravings and lower the chances of relapse. Support groups, such as Narcotics Anonymous, offer valuable peer support and accountability, which can be very motivating during recovery. Rehabilitation programs provide more intensive care, either inpatient or outpatient, addressing the physical, psychological, and social challenges of addiction. Finally, aftercare and relapse prevention are essential for long-term success, offering ongoing counseling and support to help maintain sobriety and prevent setbacks. Together, these treatments form a comprehensive approach to overcoming drug addiction. It's clear that awareness and continuous support play a vital role in tackling drug abuse effectively. Recognizing the problem early and providing sustained help can make a huge difference. Education is another powerful tool, especially when aimed at young people. By clearly explaining the risks and long-term consequences of drug use, we can empower them to make safer choices. It's also important to promote healthy ways to cope with stress and emotions, teaching skills that don't rely on substances. Finally, creating safer environments by limiting access to drugs and building supportive communities helps reduce the overall risk and encourages recovery. These combined efforts form the foundation of prevention and positive change.